Water and Health in Disasters and Conflicts. My name is George Assad. I am here on a panel with speakers, Dr. Patricia Meinhardt to my left, Director, Center of Occupational and Environmental Medicine at Arno Health, Miss Judith Kimmerling, Esquire, Professor of Law and Political Science, City University of New York, and a additional ad to give some perspectives on a trip. She just came back from Haiti to report on the disaster and water issues, is a reporter, staff writer for the Philadelphia Inquirer, Miss Melissa Dribbin. Let me just give a quick update on Miss Kimmerling. Miss Kimmerling is a professor of law and policy at the City University of New York with a joint appointment at SUNY Law School and Queens College. After graduating University of Michigan, Yale Law School, she worked for 7 years as an environmental litigator, including 5 years as an assistant attorney general for New York State, where she worked on the Love Canal litigation and other hazardous waste cleanup litigation negotiations. In '89, she moved to Ecuador and worked for indigenous organizations in the Amazon rainforest to document environmental and social impacts of oil development there. Her findings and photographs first placed concerns about the impact of oil production on indigenous peoples and the environment. In findings and photographs first placed concerns about the impact of oil production on indigenous peoples and the environment in tropical forests on the international environmental and human rights policy agendas. Her book, Amazon Crude, was called The Silent Spring of Ecuador by the New York Times. In the U.S., it prompted a prominent class action lawsuit, Aguinda versus Texaco, Inc. She currently serves as international counsel for Om Gampat Kiwigimani Harani. That's the best I can do. An alliance of indigenous Harani communities who came together to protect the 758,000 plus hectare area of rainforest known as the Intangible Zone. Located in traditional Harani territory and the Yosemite Biosphere Reserve, the Intangible Zone is also home to the last known group of people still living in voluntary isolation in Ecuador's Amazon region. Professor Kimmerling also serves on the Technical Advisory Committee of Red Oil, a network of Alaska natives of 7 tribes who joined forces to address the impact of the oil industry in Alaska and promote sustainable development on native lands. She received the Field Museum's 2007 Parker Gentry Award for Excellence and Innovation in Conservation, Environmental Biology for her courageous and relentless work. Ms. Kimmerling?
Oh, I'm first? Okay.
Yes.
I think I'm first.
Oh, I'm sorry.
Oh,
okay.
Is that all right? We're all queued up, and then I'll get this photo.
And Miss Meinhardt. Dr. Meinhardt is an occupational environmental medicine physician specializing in diagnosis, treatment, and prevention of water-related disease resulting from biological and chemical contamination of water. She's a partner in Martin Blank and Associates, a medical consulting firm that provides public health subject matter expertise to numerous private and public organizations. Dr. Meinhardt presented the keynote address at the Global Conference on Microbial Contaminants in Drinking Water sponsored by the Singapore government. She has provided medical preparedness training addressing water contamination emergencies at the request of the Institute of Water Officers in London, England, and the WWO in New York City, our organization, sponsoring organization. Dr. Meinhardt?
Thank you, everyone. Thank you for the introduction, George, and good morning, everyone. We had a pretty intense day yesterday, so you're the core, the diehards that come back for the second day, so we're very happy to have you as part of our session. It's a pleasure to be participating in this high-level conference on water and global health here at the United Nations. And when Dr. Valdoff asked me if I would participate in this important conference, I agreed because my mission as an environmental medicine physician is certainly your mission. It's one and the same. And that is really to protect the health of our people, our communities, and our societies when a water disaster occurs. Now, I know that we have a very diverse audience. I know that we have some healthcare providers, emergency managers, a lot of community health and government authorities. We certainly saw a lot of water experts and environmental health experts, engineers yesterday from many different countries and UN missions. And this is exactly the kind of conference that I like to participate in because I'm a very strong believer in a multidisciplinary approach to all things related to water. particularly water disasters. There's a huge need for strong partnership from all of us, and this is particularly true with my subject area. When discussing medical preparedness for water disasters, I really need to have an engagement of all of you and all of your expertise to assist me in providing the kind of medical preparedness necessary for a major disaster. So my mission this morning is to present my perspective on necessary strategies for preparing and responding to a water disaster. And really, I have two goals. My first goal is to present about 15 key strategies for medical preparedness for water disasters that really are applicable at the global, the regional, the country, and the local level when preparing for water disasters. Now, I've trained about 20,000 physicians and disaster response personnel all over the North American continent and the globe, and I generally spend an entire day talking about medical preparedness for water disasters. So clearly, my 20-minute presentation is really going to be major themes and strategies. There's a lot of depth behind each one of these strategies, which the second part of my goal this morning is to sort of start a dialogue with you during our session for you to tell me which of those strategies you find challenging or which ones you would like to spend a little bit more time talking about. So I'm going to give you the Cliff Note version of my day-long training session, but I hope that each one of these strategies has some application to your responsibilities in your communities. These strategies apply to large-scale centralized water delivery systems. They also apply to very decentralized, small-scale water sources. So I'm hoping that the strategies are applicable to you in many different ways. So with that, I'm going to get started. We're going to hold all of our questions till the end, and hopefully we can have a dialogue at that point and discuss some of these strategies in more depth, whichever ones are of greatest interest to you. Now, there are many unique medical challenges that are created when a water system is damaged. Now, this applies whether it's a natural disaster. We have plenty of man-made accidents in the world that cause major water disasters. Judith has dealt with several of them, and I don't want us to underestimate what can happen when there are man-made accidents. We have the concept of terrorist activity. Water terrorism is still an issue in our world, and there are certainly many examples of water being used as a weapon during war and social conflict. So there are many, many challenges that arise from these various types of challenges to water systems. Now, Dr. McGee talked about this yesterday, and I think it's absolutely true. Water disasters are democratic. All nations, all economies are impacted by and are susceptible to these large macro forces and global challenges that often result in a water disaster. Developing countries, transition economies, and developed countries. What's ironic to me is even though our economic resource base may be dramatically different, many of the challenges that we face are very similar. So I'm going to be talking about this in terms of all economies and all possible disaster preparedness strategies, no matter where you live in the nation. So let's just talk about the obvious. We clearly understand the vital need for water for basic human survival, and we also understand that water disasters create very serious and unique public health threats for many reasons. First of all, clearly, safe drinking water is vital for human survival to prevent dehydration. Recent example of Haiti. Children, many dying from just basic dehydration. Common survival. Dr. McGee gave you that great graphic about the percentage loss of water in the human body. I think many of you were surprised how narrow the range is. So safe drinking water is vital for human survival. Secondly, water is essential, again, we talked about this a lot yesterday, for basic hygiene and modern sanitation methods, including wastewater treatment and hand hygiene. Third, water use is critical to every sector of an industrialized, transition, and developing economy. It's an essential component for the production of many goods and services. I always tell people you have to remember water is like an industrial solvent. We use it in almost everything that we do and produce. And finally, again, Dr. McGee describing the use of water in agriculture, uncontaminated water is crucial to food production and livestock health. All of these are impacted when there's a water disaster in a major way. Now, contamination of a community water system with either biological or chemical agents can result, again, natural disasters from hurricanes, floods, and earthquakes. I think we've had our fill of those examples in the world.